Hi everyone, I am your nursing student Brian. For today's video, we are going to perform a physical examination, okay? Such as the head, eyes, nose, mouth, ears, sinuses, and the neck. Physical examination is important tools in assessing the health status. Approximate 15% of the information used in the assessment comes from the physical examination. It is performed to collect objective data to correlate it with the subjective data. One of its purpose is to collect objective data from the client to detect abnormalities with systematic technique early, okay? To diagnose diseases and to determine the status of performing the procedure, we need first to introduce ourselves and verify our client's identity. Hi, you do, ma'am. Good afternoon. I will be your nursing student, Brian. May I know your name, please?
I'm Ransel Lomio.
Your birthday?
June 11, 1999.
Okay, so you're from Burawin, am I correct?
Yes.
Okay. After that, after identifying or verifying your client's identity, you need to perform hand hygiene. By performing hand hygiene, this is to prevent the transmission of any bacteria or viruses. After performing hand hygiene, we need to provide privacy for our client or patient. Okay? We are going to provide privacy by closing the door, the window, and using curtain to provide privacy to our client. After providing privacy to our client, we will move to the next procedure, which is inspecting the head for size, shape, and configuration. Ma'am, can you look at me? Okay. Okay, based on my inspection, the head is symmetric, erect, and in the midline and appropriately related to the body size, which is normocephalic. Okay, there is no lesion visible. Okay, next is we are going to palpate the head. Note for consistency. Ma'am, I'm going to palpate your head. Is it okay?
Yes.
Okay, I am using a gloves. Alright. Is there any pain, ma'am?
No.
How about that one?
No.
This one?
No.
Okay. Alright. Normally, the head of my client is hard and smooth without any lesion, tenderness, or swelling in masses. Okay? There is also no lice and indication for alopecia areata. Next is we are going to inspect the face for symmetry, features, movement, and skin condition. Ma'am, can you look at me? Can I touch you? Is it okay? The other side. Okay. Ma'am, can you straight your head? Okay. Based on my inspection, the face is symmetric with elongated appearance and there is no abnormal movement noted. Next is we are going to palpate the temporal artery. Ma'am, I'm going to touch you. Is it okay?
Yes.
Okay. Okay. As I palpated on the temporal artery, it is elastic and not tender. Next procedure is we are going to palpate the temporomandibular joint for swelling, tenderness, or crepitation. So I'm going to palpate, ma'am, your temporomandibular joint. Is it okay? I will ask you to open and close your mouth and tell me if there is any pain, okay? I'm going to touch you. open, close, open, close. Okay. Did you feel any pain?
No.
Okay. So as I palpated the temporomandibular joint of my client, there's no swelling, no tenderness, or crepitation. The mouth opens and closes fully. Next is we are going to perform the physical assessment of the eyes, okay? So first procedure we have is we need to inspect the eyelids and the eyelashes. We need to note for the position of the eyelids and eyelashes, okay? Ma'am, can you look at me? Okay. The eyelids. Can I touch you, ma'am? Okay. Okay, the eyelashes are evenly distributed. The other one. Okay, good. Based on my inspection, there is no inward and outward turning of the eyelids. The eyelashes are evenly distributed on the curve along the lid margins. Okay. Next is we are going to inspect the eyelids for redness, swelling, discharge, or lesion. Okay. Okay, ma'am, can you look at me again? Alright. Can I touch you? Let's see if there's any swelling, redness. I'm going to use a pen light to see it more clearly. The other side. Okay. Based on my inspection, there's no redness, swelling, or lesion. There's no also indication for seborrhea, blepharitis, and infection caused by Staphylococcus aureus. Next is we are going to inspect the position and alignment of the eyeball in the eye socket. Okay, I'm going to use a pin light, ma'am. I'm going to check your eyeball, okay? Can you look at me directly, ma'am? Okay, very good. Alright, the other side. Okay. Can I touch you, ma'am? Okay. The other one. Can you look at me directly, ma'am? Alright. Based on my inspection, the eyeballs are normal. They are symmetrically aligned, and the eye socket without protruding or no indication rather for exophthalmos or hyperthyroidism. Next is we are going to inspect the bulbar, conjunctiva, palpebral, and the sclera. Okay. We need to note for color, texture, swelling, or lesion. Okay, ma'am, I'm going to check. I'm going to hold you again or touch you. Is it okay? Alright. Bulbar, conjunctiva. Okay, very good. The other one. Okay, the other one. Okay, very good. No swelling. The other one, please. Okay, the sclera is white. Okay, based on my inspection, both conjunctiva is clear, moist, and smooth. No swelling or lesion. No foreign bodies. No indication for conjunctivitis. The sclera is white, which is very much normal. Next is we are going to inspect the lacrimal apparatus. We need to assess the areas over the lacrimal gland and the puncta. We need to note for swelling or redness. Okay? Okay, ma'am. I'm going to touch you, ma'am. Is it okay?
Yes.
Okay. Going to assess the lacrimal apparatus. The other side. Okay. Okay, it's good. No swelling or redness over the areas of the lacrimal gland, and the puncta is normal, and it turns slightly towards the eye. Okay. Next is we are going to inspect the cornea and the lens for transparency and opacity. In this procedure, we are going to use a pen light. Okay, I'm going to check your cornea and the lens. Okay, ma'am. Can you look at me, ma'am, directly? Okay, I'm going to check your cornea for indication of cataract. Okay, the other side. Look at me, ma'am. Okay. Alright. So the cornea is transparent with no opacities. The lens is also free from opacities. So there is no indication for cataract, ma'am. It's good. Next is we are going to inspect the iris and pupil for shape, color, and the size. So in this procedure, I'm going to use a pen light to see it more clearly. Okay, ma'am, can you look at me directly? Very good. Alright. Okay, the color of the iris and the pupil. Okay, it's for brown. Alright. So the iris is flat, round, and the color brown. The pupil is round with a regular border and located center in the iris and has a normal size. Okay? Next is we are going to test the pupillary reaction to light. So we are going to use a pin light and close the room's light. Can you turn off the lights, please? Thank you. So I'm going to use a pin light and we're going to test the reaction. Okay, ma'am, can you look at me? Okay. Okay, constructed. Alright. Turn the lights on, please. So as I perform the procedure, the pupils reacted to the light, which is constriction, which is absolutely, it is a normal reaction. Next procedure is we are going to test for accommodation of the pupil. So in this procedure, we are going to ask our client to focus on our finger or this pencil. And we are going to remain, and we need our patient to remain focused on it as we move this object closer to his eyes, okay? I'm going to test your pupillary accommodation, ma'am. So you need to focus in this object as I move closer this to your eyes, okay? Did you got it?
Yes.
Okay. So stay focused on here. Alright. Okay, so as I move closer the object, the pupils constricted and the eyes is converging, which is very much normal. Next procedure is we are going to test for distant visual acuity of our client. So we need to position the client 20 feet away from the Snellen chart. So I have here with me my Snellen chart, and we need to ask here to read each line until she cannot decipher the letters. Okay, ma'am? I want you to read this one until you cannot decipher these letters. Okay?
Yes.
Alright. So I'm going to stay over there and 2 feet away from you. Okay?
Yes.
Alright. I want you to read this one, ma'am. Okay?
A, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, P, O, T, E, Z.
Very good. So the result of the distant visual acuity is 20/20 without using any corrective lenses. So there's no indication for myopia. Next procedure is we are going to test for visual fields for gross peripheral vision. So in this procedure, we are going to perform the confrontation test, okay? So I am going to position myself approximately 2 feet away from my client at eye level. So we are going to look directly at each other. with uncovered eyes, okay? And I am going to fully extend my left and right arm at the midline and slowly move one finger, okay? So mom, I'm going to stay 2 feet away from you and tell me if what number I project on my finger, okay? Is it clear?
Yes.
All right. Okay. All right. So mom, I want you to cover your left eye. Very good. Tell me what number I project, okay?
Yes. 1,
This one?
2,
All right. Very good. All right, mom, I want you to cover your right eye. All right. Tell me if what number I project.
2, 1,
How about this one?
2.
Very good. All right. So, based on the performance of my patient or client, visual field for gross peripheral vision is normal and responsive. Next procedure is we are going to perform the corneal light reflex test. Okay, this test assesses the peripheral alignment of the eyes. So I have here with me my pin light, and I'm going to hold the pin light approximately 12 inch, okay, 12 inch from my client's face, and then I'm going to shine the light towards the bridge of the nose, okay, while the clients stare straight ahead or is focusing on an object, okay. So I want you, mom, to focus on an object, and I'm going to shine your the nose of the bridge, okay?
Yes.
Your eyes. I'm going to test your corneal light reflex, okay?
Yes.
All right. I want you to focus on an object, mom.
Yes.
Okay. All right. Another one. I want you to focus on an object. Okay, the other side. Okay, very good. Based on the procedure, I haven't seen any abnormality, no indication for deviated alignment of the eyes, and no indication for muscle weakness or paralysis. Next procedure is I'm going to perform the cover test. I'm going to ask my client to stare straight ahead and focus on a distant object, okay? So I'm going to cover one of my client's eye, and I'm going to observe the uncovered eye for eye movement, okay? And I'm going to repeat covering the eye on the opposite eye, okay? Mom, I'm going to uncover your eye. Is it okay?
Yes.
I'm going first to cover your left eye, and I want you to focus on a distant object. Is it clear? All right. I want you to focus on a distant object. Okay. The other side. All right. Based on the performance of my client, I haven't seen any abnormalities. No indication for strabismus, phoria, exotropia, and esotropia. Next procedure is we are going to perform the cardinal field of gaze test, okay? So we are going to instruct the client to focus on an object you are holding. We are going to move the object through the 6 cardinal position of gaze in a clockwise direction and observe the client's eye movement. Okay, mom, I want you to focus on this pin light while I am moving it, okay, in a clockwise direction. I want you to only use your eyes without moving your head. Is it okay?
Yes.
Okay. All right. Very good. Very good. Okay. Very good. All right. The other side. Very good. So the eye movement of my client is smooth and symmetric throughout all 6 directions. No indication for nystagmus.
Birthday to